This is Dr. Satyavani Rongali, Consultant Obstetrician and Gynecology in Cloudnine, Varthur branch, Bangalore. Normal causes of bleeding. Cervical changes during pregnancy. The cervix becomes more sensitive and may bleed slightly after sex or a pelvic examination due to increased blood flow. This type of bleeding is typically mild and resolves quickly. Implantation bleeding. Although implantation bleeding usually occurs in the early weeks of pregnancy, it's possible for some women to experience spotting from implantation even slightly in the second trimester. This should be lighter and short-lived. Subchorionic hemorrhage. A small blood clot forms between the uterine wall and the placenta, often causing spotting or light bleeding. In most cases, subchorionic hemorrhage resolves on its own without major complications. Cervical erosion also can cause mild bleeding, often after intercourse or pelvic examination due to condition known as cervical erosion or cervicitis. This usually is harmless. Abnormal causes of bleeding like placental issues. Placenta previa. This occurs when the placenta is located low in the uterus, partially or completely covering the cervical os. It can be painless bleeding, usually without contractions, and may require a cesarean delivery if it persists. Placental abruption. This is a serious condition where the placenta separates from the uterine wall prematurely, leading to bleeding and pain. It can be dangerous for both mother and the baby and requires immediate medical attention. Miscarriage or pregnancy loss. Though less common in second trimester, miscarriage can still occur. The bleeding would typically be accompanied by cramping or tissue passage, but this is not always the same. Infections of the cervix and vagina, example bacterial vaginosis, yeast infections or urinary tract infections can cause irritation and bleeding. These should be treated properly to prevent complications. Polyps or fibroids. Uterine fibroids or cervical polyps, which are non-cancerous growths, may cause bleeding during pregnancy. They often don't pose a major risk, but large fibroids may cause discomfort or complications depending on their size and location. Preterm labor. Labor before 37 weeks can cause bleeding along with other symptoms such as contractions, back pain and pelvic pressure. If bleeding is accompanied by cramping, these symptoms you should report to your doctor immediately. Trauma or injury. Any trauma or injury to the abdomen such as fall, accident or physical abuse can lead to bleeding and it should be evaluated. What's normal and what's abnormal bleeding? Normal bleeding. Light spotting or a small amount of blood after intercourse or a pelvic examination is normal. Mild brownish discharge, which is old blood, may occur and typically resolve on its own. Very slight bleeding due to cervical sensitivity or a small subchorionic hemorrhage mostly resolves on its own. When abnormal bleeding is present, medical advice is immediately required. So, if heavy bleeding or soaking through pads is present, or if you notice any bright red blood in significant amounts, or if you notice any clots or tissue passing from the vagina, or bleeding if associated with cramping or pain, or if bleeding is associated with dizziness, fainting or signs of shock, or any pelvic pain or back pain or labor-like contractions if present before 37 weeks associated with bleeding should be reported to your doctor immediately. How to stop bleeding in second trimester? If you experience any significant bleeding, particularly bright red blood, or if it is associated with pain or cramping, contact your doctor immediately. They may recommend ultrasound to assess the pregnancy and determine the cause of the bleeding. If bleeding occurs after intercourse or pelvic examination, your doctor may suggest to avoid sex or any activity that might irritate the cervix until bleeding resolves. You should monitor your symptoms like the amount of bleeding or any associated symptoms like pain or abdominal cramping. These changes, if it is present, you have to report to your doctor. If any underlying causes are identified such as infection, fibroids or placental tissues, your doctor will suggest appropriate treatments to manage the condition and prevent further complications.